Fantastic. And if I can just get permission to share slides, that's terrific. All right. Welcome, everyone. And I'm so sorry for the technical difficulties that we had at the beginning. We are absolutely thrilled that you are here. As Claire was saying, we have a wonderful lineup of speakers for our Summer Digital Health Industry Summer Speaker Series, and very excited to be partnering with the Society of Behavioral Medicine for this series. So Claire got to tell you a little bit about what TYDE does. So I'll let you hop on the website and learn more about our mission and some of the different training and conferences and events and partnerships that we do, and really encourage you to get involved. And we're particularly excited to be launching this week for the first time our industry affiliate program. And so with that program, we are eager to have people who have different roles in industry connect with TYDE. It's an opportunity for different types of collaborations, research collaborations, other ways to be connected, as well as opportunities to apply for our seed grants together or external funding, and a chance to learn more about the research that we do and for us to learn about the great work that you are doing as well. So the QR code is there, or feel free to visit tide.virginia.edu for more information and to get connected. Today, though, I don't want to delay any further because we have a fabulous set of speakers. So Emre Sezgin and Tony Ma are joining us today, and I'll invite them to come out and join us here. They are a fantastic lineup to get us started. So Dr. Emre Sezgin is an assistant professor of pediatrics at the Ohio State University College of Medicine and a principal investigator in the Center for Behavioral Health at Nationwide Children's Hospital. He is a digital health and AI researcher whose work focuses on developing and evaluating conversational agents, clinical AI tools, and privacy-preserving technologies to improve care delivery and address health-related social needs in pediatric and underserved populations. And Dr. Sesgrin's research spans clinical informatics, implementation, health services research, and has funding from NIH, HRSA, PCORI, as well as industry partners. And that brings us to Tony Ma, who is a social entrepreneur, a seasoned researcher, and former management consultant with more than 2 decades of experience in mobile, telecommunications, and digital health technologies. As co-founder, CEO, and president of Benton Technologies, Tony has led the development of innovative digital health and therapeutic products, particularly in maternal and child health. He has secured more than $50 million in non-dilutive funding from organizations including NIH, CDC, BARDA, as well as private foundations. And Tony is open that his passion for maternal health is deeply personal, rooted in his own birth in rural Vietnam, where his mother nearly lost her life. And it's this experience that really fuels his commitment to creating scalable solutions that improve the prenatal and postpartum journey for underserved populations. Tony has many, many accomplishments, but I have to highlight one in particular. That is, Tony is a Wahoo because he has a Bachelor of Science in Systems Engineering from the University of Virginia. And with that, please join me in welcoming Emma and Tony if they want to come out. Wonderful. And I'll let them come out from backstage into the webinar. Welcome, Tony. Good to see you.
Yeah,
Thank
good.
you for joining us
For having
today.
me there.
Great. And we'll let Emery come in as well. Fantastic.
Hello. Yes.
Welcome. Good to
Took
see you
took me
both.
a while. Yeah, good to see you too. Thank you for your kind introduction.
Yeah, no, and let's dive in because we have so many questions we want to learn about from you today. So why don't
Mhm.
we start though, kind of big picture? Can you describe the goals of your partnership and the work that you do together? Tony, you want to start us off?
Sure. So again, we're a big believer in team science, right? It takes a village, and from that perspective, I think I met Emra several years ago at a conference, and it's a great way to meet academics and different people. And he was looking, it was at a voice conference, so he all his work around that space, and we're always looking for people that have expertise in various skills, whether it's clinical, data science, and he had specialty in AI. And so from that perspective, we had a common interest in children pediatric care because of my maternal child health space. And so we went to having some conversations, and we brought some strengths to the table, such as our ability to get SBIRs and other types of
Yeah.
funding. That started the conversation. Emra, you don't want to add anything?
Yeah, that is how we started our conversation. And the motivation is always has been the bringing the impact and showing the impact of our research because the work we are doing is with the federal grants or other grants could be limited to the duration of the time. But when you have this evidence, you want to see real the outcomes and the impact for the society. So these kind of initiatives like collaborations are really helpful to work on it together, understand how we can disseminate and scale up your the solutions that you bring. So that is kind of like that has been my main motivation with collaborations.
No, that makes great sense. And for those who may not be familiar, do you want to describe an example of some of the project and work that you are doing together?
So right now, one of the things we're focusing on is this platform called SpeakAll. So we're looking at pediatric care and how do we leverage that space. So we've won some other funding from NIA to build a smart speaker, and from our perspective, it's really more of a hardware piece. And Emra has been doing this Daphne device and tool. So we saw there was definitely common areas for collaboration, and it's a strength for him. We've been collaborating with other professors and at other universities as well, but in the pediatric space, this is where Emra shines. And so from that perspective, we say, hey, let's partner on that and work on this solution together. And we were been working on that SpeakAll application.
Great. And can you talk about what the application is ultimately going to be used for?
So it's supposed to support basically children with leukemia to support them on their care journey post discharge. So there's a period where we are also working with other researchers that Emra introduced us to at Nationwide Children's. So that platform is supposed to be a platform with a mobile app to support the parents that are supporting a child that's been discharged, because there's a potential for relapse as far as medication adherence. Once a child has leukemia, there's about a 2-year period where it's a pretty stringent requirement to adhere to this medication management process. And if you do that, increases the likelihood. But if there's relapse, then there's negative outcomes as part of that piece. Micah is one of our MD collaborators on that, so she could speak more to the science. That's why I think it's key to have the team sciences approach, and why Emra is so important with his expertise in voice and chatbots and that. So.
No, that's great. And you've talked a little bit about this, but how would you describe your different roles in the partnership and what you're each sort of doing more practically in the work?
Yeah, I mean, for that we at our side, let's talk about this SpeakAll project, right? And we've been one of my partners at the clinical from the clinical perspective and look oncologist, Micah Skins. She brings the clinical knowledge, and she's also working on medical adherence component. What I've been doing before, like working with the conversational agents and voice assistants, building them, testing with the kids having chronic conditions and at the home setting, how we can leverage this technology, connect with the patients and the caregivers, and to understand if this is going to be helpful for them to take notes and track symptoms, medications. And I brought that kind of knowledge, and we together and with Tony's expertise and industry knowledge in SBIR, we kind of thought that this could be a great opportunity because we have the evidence that we kind of accumulated over the years with our research and the research grants. And the next step is going to be like thinking about how we can scale this up, how we can make this useful for broader range of families, not only the families we built this intervention for during this study period. So that has been kind of like a great kind of like collaboration component for us, like the expertise from different niche areas comes together and works towards this common goal.
Yeah. And I think it's really key for us, really having an impact, right? It's not just building products and tools. And that's what Emra brings, that research background and having shown the evidence, the efficacy, the different challenges around developing really viable chatbots, voice type agents. And that's where his expertise comes in. And for us, again, coming with the industry, and we've also built a background in being able to get SBIRs fast track. So we've gotten multiple, we've, a lot of researchers actually poured into us. So they actually taught us how to write grants. So we started out writing SBIRs, but then they taught us how to write R21s, R33s, R01s, and we've gotten all those. So again, it is that mentorship and that partnership. And over time, it really does take the different pieces where you know where your expertise is
Yeah.
and where you can collaborate.
No, I appreciate you talking about sort of the commitment to team science, because I think that's the only way to really effectively do this work and have it have impact. Um, for those who are watching, we're thrilled you're here. If you have questions that you want to add to the chat, feel free to do that. And we'll try to hit as many of them as we can. Or add them to the Q&A, maybe easier actually for you to have access, and we'll try to hit all of them if we can. I would love though to learn a little bit more about how this partnership began. So you said at a conference, but how did you kind of build it and initiate those conversations and figure out that you were a good fit for one another?
So actually, so that was when our partnership really began. We actually met years earlier.
Okay.
Emma probably remembers. So we were pitching for a competition at HRSA. I don't know if you
Okay.
remember that. So
This year,
yeah,
yeah,
so
yeah,
he had already, he was pitching for another round, and so we were competing with his colleague on other, this other
Got
one
it.
was the HRSA Maternal Child Bureau's pitch, and we saw the great work that he was doing, but we were pitching against his colleague, and so at that time we say, we would love to learn more, and then so that was the start of knowing who Emra was in that field, right? So,
Right.
oh, he's been doing this. And then we were invited by Nationwide Children's under, I think the CEO, his first name was Simon. I forget his last name. And so we went there and met Emra again. So it was the second contact. But by the third time when we met at this conference, we said, let's work on something. I said, when we first met you, you were already working on this great thing, and so around the voice piece. So this is the third time's a charm. So let's work on something, and that was
You're following each other. It's
yeah, we're
like,
just following each other
yeah,
and met each other multiple times, and
yeah.
serendipity. And
yeah.
then because of that, and he was interested because I think by that time too, early on, like 2.5 years prior to that, it was I think still early stages. But at that time, Daphne had publications, all these other evidence behind it. We said, let's move forward with that partnership.
Yeah, definitely. The last part is important. Like with my research, I need to get to this kind of maturity of the progress that I believe it is now ready for kind of next steps. Like when we first met, it's just like grounding up. We are trying to build this prototype, getting some evidence, and that HRSA Challenge Prize has been one of the like seed fundings that we can ground this up, do the interviews and do some surveys, and then refine the app. And once we get this and publish and we think, hey, this is going really somewhere, like we got the evidence and
Yeah.
we think this is gonna work. And then like I was like personally more open for like expanding this and collaborating. And that also comes with, with my mentorship and institution have certain expectations. And you
Course.
cannot just go ahead and say, hey, I have an idea and I need to just go build a startup or just go for HPR. It doesn't unfortunately work like that. So that's why you need to just use this academic knowledge and gather the evidence and put things together and then present it like to Tony and your mentors and the institutions, showing that this is gonna work. And that is like how we started with Tony. Like in the third time, it is also not only the series of coincidence. It's also the time that like, I went to this voice conference because I have a product and I'm curious about like what industry is doing. And
Yeah.
Tony was there, and then we were just start chatting about that, and then it just kind of clicked that this is the time we can start collaborating.
And just to follow up on that, that's super interesting. You're both highly accomplished and I'm sure have outreach from lots of people who might want to collaborate with you and partner with you. What are you looking for to figure out that this could be a good fit. So what was it in that third magical meeting that made you say, hey, we should really move this forward? This makes sense for us to work together, and had that sense that you would be good partners together.
From my
Yeah.
perspective, I was, go ahead, Emily.
No, no, go ahead, please.
Yeah, I was just looking at maturity, right? So if it's especially academics, like part of that is, you're going from bench science, and if it's at a point where it's translational, then that's really key. And so again, when we first were at this pitch competition, it was still early. Our product was still early, and so it didn't make sense to partner at that time. But I was still very interested in what he was doing and meeting multiple times. But by the time we met at this voice conference, it was definitely more mature. I think it was like 2 years down the road. And so from that perspective, that was one of the qualities from a business perspective I'm rating for. If it's still ideas and concept, that's not going to help me from the SBAR mechanism, for example, which is around commercialization and the driving towards commercialization and impact further. So that's one key. And secondly, of course, we're social entrepreneurs, so we look for aligned interests and values. And so that's through conversation, finding out that a lot of professors are, but not everyone. So being able to do that, and then of course relatability. So, but it really came down to those three qualities: is the technology ready for translation and commercialization? Do they share the same values as us? Because we're going to be in bed together. I mean,
Oh, for
for a
sure.
long period of time, and and then as are we relate? Can we work well together? And I think it's been a great partnership.
Interpersonal connection.
At least that's what we were looking for. So I don't know, Emra, if you had other things you were looking at
Before
before.
turning to Emma, let
Okay.
me follow up because I think that's super interesting. When you say shared values, what are those? What is it that, matters to you in those ways?
So for me, it's about social entrepreneurship and conscious capitalism. Those are my two key things. So social entrepreneurship is the ability to not only do good, but do good for well, because it's our tax dollars hard at work, right? A lot of the research funding that we get, whether it's SBIR or traditional research, or come from these tax dollars. So
Mm.
so there's an opportunity of not being greedy, doing good, and bettering society. I'm in my mid 50s, and so I want to leave the world a better place for my three kids. And then conscious capitalism is really around that part, as well as how capital can be deployed to have an impact and affect more people. So.
Great. Emma, what would you add in terms of from your perspective?
Tony said most of the great parts actually. Um, for me, like this, like that shared value comes from like we kind of like make like I'm working with AI, right? And there's this concepts of responsible AI and fairness when we are using. I'm kind of trying to focus on those. So it is always about the technology and also how to make this right for the society. Like the project we collaborated with, like started our communication has been SpeakAll. It
Yeah.
was a project we initiated internally to help like families with case having chronic complexities. So that was kind of like initiation, showing that what we value, and he kind of shared his projects, and then we kind of like around that idea, we think that we are aligning. Like you are not a person strictly going for the profit. I am not a person like kind of chasing the profit. So we have like kind of common ground. So that kind of like initiation
Yeah.
and kind of like having feeling of that value and what that's saying like we can work together. Another thing is like Tony also have an understanding of this academic like environment ecosystem. Like we need to chase grants, we need to wait maybe a couple of years to get the funding. So if you go for a startup and try to explain this, it may not make sense, and
Right.
they like need to raise the capital immediately, and that is kind of misalignment, and it's not going to work both of the groups. But with like our collaboration, we understand different mechanisms. Like it could be like fast track mechanisms, or like shorter and longer term that
Yeah.
we can strategically think together. That has been really kind of also kind of contributing to our kind of partnership and collaboration.
Yeah. Okay. And we try to support, adding to Emma, we do understand the academic route, the need to publish or perish. So we support
Yeah.
that as well. We're always trying to build. And so we're thinking at that. And that's also helpful. But a lot of small businesses that enter this field don't realize that actually uh, peer-reviewed manuscripts and others do add to the branding and add to the validation of the work that you're doing. So, but that does take time. And then having them as first author or co-op, depending on where we are, building that and understanding that so that you create win-win partnerships. And so we're
Right.
always looking at those pieces.
No, that's great. And we're going to come back to sort of these, how you navigate when there's different incentive structures and different priorities and, all of those kinds of things. And that leads in, well, how do you define shared success? So at what point do you sort of say, both of you say, nailed it, this went well? Yeah, how would you define that?
Want to go, Emma?
Well, shared success, that's a good question. Like here we since I said like we share some the values, like one of the success metric is the impact we may create. So, and also, of course, the grants and publications could be like generic success metrics you can think of. But I think we should include there like perseverance of like we keep going. We just don't stop, hey, this grant failed and I think it's not working. We just kind of have this kind of sense. Like he reached out to me, I reach out to him. Like I have this idea. Like Tony mentioned a couple of times, like this Daphne project is one of the new projects relatively than the others, which is kind of building chatbots for halfway the social needs, serving like underserved populations to find resources. It's kind of a new concept. I kind of try
Yeah.
to make it like in like to a position that we built the prototype, we have the product version of it, like we have some evidence, so that's kind of like we were exchanging some ideas, like how we can make this like available for like low resource communities. So these kind of like mindsets, I think also a great kind of metric, maybe not measurable immediately, but like
Hmm.
for shared success. And I believe even though like we are still, of course, working on SPR grants, that would be great when I believe we are going to land one, of course, but that towards that direction, like we've been working for a couple of years, I think it's kind of like shows some
Yeah.
successful progress for us.
So the sustained partnership is part of the design.
Yes,
And then,
yes,
of course, the impact of the work. Yeah.
yeah.
Yeah, I totally agree. Nothing more to add. So great.
You guys are in sync. I like it. One place that is sort of notorious for raising challenges that the timelines in academia and industry tend to be a little bit different. You alluded to this in terms of like applying for grants that can be a very, very long process and things like that. But also, for many academics, they're teaching, they're doing a whole bunch of additional things along with the research that they're collaborating with you on, and approvals in academia for MOUs or whatever it happened to be tend to be slow and bureaucratic, whereas I think there's certainly at least a stereotype that an industry that moves a whole lot faster and the timelines are faster. And so I'm curious how you face those challenges, if you face those challenges, and how you've navigated timeline differences.
So from a business perspective, I think one of those is really planning ahead. So we've had multiple years to work with different academic institutions. So two of the biggest hurdles I've seen is actually the IRB legal, and so we've had cases where a legal agreement would take like almost a whole year. So
Yeah,
that was with so that can definitely, so we understand it up front, and then um, basically phasing, like if we're doing a fast track, you might want to have an MOU up front during the phase one because you haven't demonstrated all the feasibility, and then in the phase two then have more concrete, but also having that shared understanding and the small business understanding that yes, the universities have a lot more red tape, so you got to plan ahead for that. You got, if you're planning to submit a SBIR fast track, you got to at least get to the budget office 2 to 3 weeks before the due date. You can't say two
right.
2 days before to get some of that. Although I know there's been times, challenges and disagreements, but I think the part about the university is them being flexible where they can, but understanding that we are trying to work around those red tapes and understanding that. And I think a lot of the academics that have communicated their challenges ahead of time when their office of sponsored research, office of research, I think they go by different names. If we understand that timeline and work towards that, and of course understanding it's not the professor, assistant professor,
Right.
that has the challenge. It's
No,
this
for sure.
overarching,
It's the
they
bureaucracy.
want to get their product and their solution to market too, but it's this red tape that they have to operate in. So if we understand that a little bit, then we can try to work together. So that's been
Yeah.
our experience for achieving success.
So from the academic side and inside from the kitchen, I can say that I like you may not have a protocol and you may not have like a solid uh, idea of like how this technology will work, but you have like let's say you are going to build a mobile app for tracking symptoms out of the clinic. And I think the immediate action from academic side, you need to communicate like with IRB in terms of the research, like just the meeting. Like you can just explain to get like some feedback, like what could be what they've been looking for like they may say you need to like HIPAA compliance to do
Mhm.
that. So you may just try to work on that. You may need to talk second with your IS leaders, information systems leadership, because if there's some sort of technology, you need to get some approval. And when you start IRB, they're also being triggered or like I forgot the term. The IRB kind of seeks feedback from IS teams when it's about technology, and you need to communicate early. And if possible, leadership. In our hospital, we have this leadership to review all the technologies being used in research. That could be a great initiative. And then, of course, Office of Technology Commercialization and Legal are there going together. Since you are planning for some commercial pathway, it is great to have time to talk with them. And that Office of Commercialization, Legal, and also compliance, they're kind of that you can put it under one bucket. Then you need to communicate with them to make sure everything's all right with them. After that, you can just spend more time on this collaboration, building this technology, and maybe writing grants. And before that, I think it can be really frustrating. First, if they don't agree. Second, if they don't have resources to support you on this effort, because some of these institutions doesn't have any idea of this SBR grants, the landscape of it, and it may come to a degree that okay, we got the SBR grant. What we're going to do next? Like we're going to build a company, and there's this kind of allocations and everything, and your institution come back and say, hey, who's going to own this IP of this work? And you may say, hey, this is an SPR. They may need to own okay, we don't agree with that. And then it just collapses, right? Those are some unfortunate kind of scenarios. We haven't had that, but I heard like those are some scenarios. That's why we need to be prepared with talking with the right groups up front to make sure everything is good to go.
No, that's great. And actually, my next question was going to be about handling issues tied to ownership of intellectual property. So that's a lovely lead in because that is a sticking point, for a lot of partnerships that we hear about at any rate. And so I would love to understand how you've approached that, how you think about those issues, but also, tied to your earlier point, Emma, I'm really curious how you sequence this, right? So how you're thinking about when you're talking to a licensed venture group about commercialization, when you're talking to IRB, when you're talking to information technology, when you're talking about, to program officers for applying for an SBIR, right? Like there's different barriers from different groups that can arise. And how do you lay this out if you could kind of talk through what that looks like and then particularly talk about the intellectual property issues?
Yeah, for myself, typically I think it's pretty clean. Like when we're approaching academics, like for example, Emra and he has the Daphne and all these things. We know that that's the intellectual property that he has. So there is also what's called a commercialization plan if we're going for an SBI or a fast track.
Right.
So it's spelled out in there, right? And from who owns what piece. And so there are intellectual property that you may co-create as part of that. So you may define during the research things might come up. You might develop maybe a new part of a widget, or maybe so that those are co-owned. You come in with the academics with what they already have up front, and then what do you co-develop? And it could be content too, right? So we might design with like Micah or something like that, special content around like the SpeakAll, where there could be specific training or education, and that could be co-owned, right? So there's that understanding. And of course, on the Benton side, what parts can we own, whether it could be other content, or it could be parts of the software, or it could be the scaffolding, and then Emra owns the code and the data science. So there's clean ways to kind of segment that. And then again, our motive as social is to create win-win, and that's win-win where we understand the roles and the mission of not only the professor getting their work out, and how that could also lead to tenure and full professorship, but how the university wants a right. I mean, they own everything, the professors and the work. So we understand that, and we know we want to make it win-win. So when we come in, we have that understanding of that it's a partnership, and which part does each one bring into the table, what could be co-developed, and how could we create that co-ownership too. So that usually makes it pretty straightforward for us, and we haven't had any problems yet.
But there are 2 points here Tony mentioned. Like one is this promotional steps, and some institutions may not acknowledge SBIR grants as like other NIH grants. So that is one thing to clarify. If you think like this is going to help my promotion, and
Right.
if you go and they say, "What is this?" we don't include that with your like promotional kind of steps. So that is important. One thing. The other thing is about I forgot. I drifted. I'll come back to that later. So I forgot.
No,
Sorry
you're
for
good. You're good.
that.
I'm sure it'll come back, and yeah, this is super,
Yeah,
super helpful. And I think, one thing tied to also, you know, Tony, you've done this multiple times, and you have a mature company and like all of those kinds of things. I think I'd be curious to hear either of your insights. Like, I think it's in some cases more challenging for like really early stage startups as they're kind of establishing and trying to think about some of those intellectual property issues and things like that. And I'm curious if you have any comments or experience there about how that can
yeah.
play out in other ways.
That is
Yeah.
what I was trying to remember, actually, to be
Okay.
honest. Because I was going to say, like, not
We're
everyone
on
could,
the same wavelength.
yes, not everyone can be like Tony and Benton. Like, they may not have that kind of mindset. They could, like, they can come and they want to collaborate because they're building health technology and they need to get this endorsement from a
Right.
hospital, and you're part of this hospital. And if they can put the hospital logo in their web page, they can sell the product, and there's this motivation. But they don't have any experience with grant writing. They don't have understanding. I mean, you can definitely. I have worked and I've been working with other startups too, but they have a basic understanding how things works, and we kind of have some common ground with like, okay, you can license this product and we can collaborate on kind of evaluation of this, and I cannot have more than that unless we secure a grant. So if you build that kind of like, if you understand and be on the same page, and
Yeah.
also, of course, this include like our hospitals, like commercialization team, and they also needs to be part of this conversation. Not everything, especially with the talking with the startups. My strong suggestions is not just go ahead and like you can go introduce yourself, but when it comes to building partnership or kind of sharing some product details that you're building, some research details, always include the commercialization team. So because they know how to communicate and to what degree you can share, or if you need to disclose your IP first, and if you need to sign NDAs or some agreements before sharing this, not be sure that your IP is not stolen, and then you can just start conversating around this. And I had some conversations from like some domestic startups or international startups with different motivations. This is kind of like it's not like there's no prescription for that. You are gonna expose to that conversation and learn from that. But basically, like, the motivation here, just there to sell the product, but it's not a bad thing. I'm not saying it's kind of bad motivation, but there could be some opportunities in there that you can make this scalable and successful, impactful product out of this. So you just need to find that you need to kind of align and find that common ground that everybody will be comfortable.
No, that makes a lot of sense. So I'm taking away, interestingly, things that I think probably apply to all partnerships in some ways and are
Yeah,
extra important here. Transparency of what you can and can't do,
yeah,
shared goals, good communication, and bring everybody to the table early who's going to need to be involved. And that's sort of, what helps you to get there. Um, Tony, you made a really nice comment earlier about sort of that when research findings are published in peer-reviewed journals, that really adds to the scientific credibility from an organizational perspective, as well as it being, key, Emma, for like, promotion and tenure and all of those kinds of, sort of academic review pieces at the same so clearly a win-win, and at the same time one of the things that can be challenging is on the academic side wanting to publish findings regardless of how clean they are, whether it makes the product look like it worked effectively or didn't work so effectively, and needing to do that fully with independence and all those kinds of things, and yet that also being challenging sometimes on the company side because it could be not putting forward findings in a positive light and all those kinds of things. And I'm wondering how you both think about that, how you've approached those issues,
Mhm.
and
From
kind of how
Benton's
you
side,
in advance prepare for that so that it doesn't come up later. Yeah.
yeah. For Benton's side, actually, we're okay with publishing negative stuff because you're going to learn from it, right? So sometimes, I guess, because we see it from a different lens because we know we can get other grants, and so from that perspective, that's not a barrier for us to move forward and publish because you're going to learn from it. And the key is again that shared value as far as how can the community, other researchers, other small businesses learn from it. If we put a different approach or maybe a methodology that doesn't work, I want to publish that, right? If a particular method that was developed by scientists is shown not efficacious, then we want to be able to publish that information or maybe that current approach. So, and there's a discussion section in most of these manuscripts. So you can say, hey, here's where more research could be done. So typically it's going to be iterative anyway. So if you take that mindset, then you should publish positive or negative. Of course, you want more positive, but you're still going to learn from the
It's
negative.
a learning opportunity. No, absolutely.
yeah. I
All right,
think
anything you'd add?
I agree. I'm sorry.
Anything that you would add?
I agree. I agree with the transparency, and I agree that the market appreciate the transparency because like you are sharing this with really intelligent people. They can see if you're kind of giving the tailwind and then try to make everything positive. It doesn't work like that. Like if you're also having like HBR grants, right? You're kind of obligated to share what you find, and you cannot just be selective. And as Tony said, you can show the negative sides, and that's kind of speaking the not only technology you're building, it's kind of like the whole landscape of this. Like let's talk about AI chatbots and mental health, right? When you build something around this and you do research, that kind of speaks to that kind of domain. So
Mm.
that's very valuable, and it will also contribute to your reputation, in my mind. So I kind of like I don't hesitate to share that kind of like knowledge being found through the research. And if there's like a disagreement with the company that I'm working with, that is kind of like a conversation. Probably I need to include more people experiencing this conflict resolution from our institution to make sure like we are okay with that. But I don't think I haven't had such an experience so far. So
Good.
I don't. But that is kind of like the what we've been trained to do. Like if there's this such conflict, you don't need to just sit down and try to resolve or agree or disagree with them. So you just need to include the right parties in this conversation.
No, that makes a lot of sense. And I think the other piece that we often think about is having those conversations early on about
Mhm.
what that publication pipeline is going to look like. And if there are, sometimes it's, I know agreements where there's no efforts to suppress any findings, but there is a like wanting an agreement that you'll give a heads up about what findings are going to come out so that companies know and stuff like that, right? So like knowing timing, pathways, all of those things, and having those agreements can be helpful as well, I think, early on. Um, but that's great. We have a great question that's come in through the Q&A. First, they say thank you for the insightful discussion. Do you have any experience co-creating with students, and can you talk about those experiences and what that has looked like, and maybe how you approach it a little bit differently because they're in those roles maybe more temporarily than a faculty member might be?
So years back, we had multiple co-creation projects with around mental health. In fact, one of them was around C-stress, which was really around mindfulness and students and mental health college students, actually, in fact. So that there was a co-creation process. We did that with UCI out in California. That was and so through that process, we are big proponents of co-creation. I mean, people with lived experience, whether it is students, moms, older adults, they bring a richness to uh, solving a problem, right? So we don't have, I call this the savior mentality. I'm not going to come in with my awesome science team. It's going to take a village, and that village includes the people that have experienced it. So your question about college students, we've co-created with across the spectrum.
Great. And Emma, how do you involve your students in this work?
Uh, Through OSU, I've been part of like I don't have active students in my role. I'm pure research, but I have mentored like fellows and undergrad and grad students within my lab. And one of the things that we work together with students has been through this community challenges or just our university, like Ohio State, sometimes hosts this kind of like challenges. We come together and try to solve these public problems. And those that has been really helpful to my probably perspective a bit more working together with students, not like trying to build something for students. But what I learned from this experience is their perspective, like especially in the because we are in the research, like we after a while you have this tunnel effect, and you may not like understand what's going on other than that. Like so, that's kind of they bring a great perspective, not only solutions but also kind of like design thinking and how we can create solutions from different perspectives. So we had this kind of challenge at OSU about building a companion for aging population to track their symptoms. So I had the chance to work with them for a couple of while, and they were really great, and I was really amazed. I kind of like missed. I used to work with students a lot, so I see that value, and now I kind of like having working with the interns in my lab, and they really bring a great perspective on any solutions we try to create.
Mhm. I'll also add, so related to like internships and stuff like that, we've actually worked. Unfortunately, I haven't worked with University of Virginia, my alma mater, but we've worked
Hopefully
with
soon, though.
I've worked with tech a couple of times. They have like a program, so we've gotten groups of students to work with them on some of these research and University of Texas, and then we've also had internships, capstones. So we've worked the gamut across the various universities, including George Mason up here. So multiple universities, different backgrounds. We've done that as well.
And I'll ask, that's a nice plug, Claire, if you want to put the link in. We have a digital health industry internship program that we help with sort of matching. We partner with Society for Digital Mental Health on that. So happy to share that. And if people are in the audience and curious about that, and Tony, we'll get you working with some Wahoos here.
Yeah.
Though this is actually a national program, so people
Yeah.
from all institutions are involved. Um, I'd love to hear what has surprised you about either this collaboration or other academic industry collaborations you've done. You're obviously both very experienced in this space, but still surprisable, I'm guessing sometimes.
Yeah, for me, the biggest surprise is, the wealth of information. I'm a lifelong learner, right? I think I learned that from my undergraduate and graduate degrees, but just, learning from Emra, learning from other clinical and really realizing that you do need that expertise, right? You come out fresh from graduation and working in this field and you think you're going to solve everything. The reality, again, back to is that you're not. there's going to be different angles, different challenges, and you do have to rely on that other set of expertise
Right.
from academic, the challenge of how do you create the voice agents and the different nuances around that. I rely heavily on Emra on that, somebody that's from the clinical perspective and trying to. So I'm surprised with all that, and being a lifelong learner, I'm always learning from everybody, from all my collaborators, and so I think that's been the most amazing thing. So on this journey of collaborating with academics, I continue to learn.
So I can chime in. The surprise is kind of like for me comes with like maybe the excitement of knowing new about new fields and
Mm.
domains. Like for example, for the technology, there is nothing anymore surprises me when something's being built. But when it comes to implementing this and talking with like lived experience partners or industry partners or even like public health partners. For example, if I'm trying to build like a chatbot for helping families, but how I can disseminate and learn from it, right? And when I try to understand what is the standard of care right now, how you are helping, what are the gaps, and the problems like the gap, when I learn about that kind of surprises me because when I think about like when think logically, this shouldn't be a big problem. It's kind of like even like with a text messaging you can solve this, but there's no maybe infrastructure, there's no
Mm.
maybe a staff member to do
Mm.
that. And that kind of surprises me. And this is not like a one-time occasion. It's just like when it comes to like public level, public health problems and the information we know um, there's this kind of like simple solutions we can integrate, but we are not able to because of this kind of political and social kind of everything. It comes together, make it inaccessible. So that is kind of like most of the time for me the surprising points, and kind of that also excites me that
Yeah.
this is a challenge I can try to work towards solving, and it doesn't have to be technology, but this is kind of the great knowledge I can try to overcome and make good.
No, that's great. And the benefits of sort of doing that are very clear in this conversation.
Yeah.
It's great. Um, Gosh, time is flying by here. We just have a couple minutes left, so I'm going to ask for your like, this could be a whole hour conversation, but I'm going to ask for your like 1 minute top answer to how you think AI is changing the way that academia and industry collaborate, whether that's the research itself, product development, implementation. What's the biggest impact you'd want to highlight in a minute?
I can say the biggest benefit is to give you as an academic, if you have no technical background, you can create what you imagine, like a prototype, pretty quickly and visualize it. That was kind of requiring like lots of steps before. And that kind of like, even you want to build a wireframe, you can just build a, visual asset that you can
Mhm.
communicate with the right partner. So that has been really a great enabler for people get into the digital health space and try to visualize and at least build a little bit what they imagine for their
Yeah,
research. That's what I can say, actually. Just one thing I need to say.
no,
Yeah.
I appreciate that.
I think for me, again, definitely speed, but then also translating and understanding, right? So, as a person with a technical background, of course, Emra going data, I was never good at statistics, right? And so, Emra and all this data science and stuff like that, being able to put it into ChatGPT and help it explain to me in layman's terms so I can understand. Although being intellectually curious, they're throwing across terms with their MDs, their PhDs, other different areas. So the translation and the speed at which we're operating is really helpful, right? So again, so I think that's been one of the biggest pieces. So a biostatistician, if they're going to put out a plan, I can understand, confirmatory factorial analysis, Emra with all his, test, retest, ROC, all that stuff will help me to understand and then say, okay, that makes sense. And so it's been very helpful and helping us, as Emra says, the speed to bringing things to market.
Fantastic. Well, I wish we had another hour to keep chatting. We only got through about half of my questions here, but nonetheless, truly appreciated the chance to learn from you both. And it's, super obvious how beneficial this collaboration has been to the work that you are each doing. And yeah, inspiring to see how well you've been able to make that work. So thank you for sharing your experience and expertise with us. And Claire
Thank you.
shared in the chat for everyone other programs that you can sign up for and ways to get involved. But a huge thank you.
Thank
Thank
you
you,
very
Bill.
much. Thank you for the opportunity.
Yeah.
All
Bye,
right. Take
everyone.
care.
Bye-bye.
Bye-bye. See you, Tony.
See ya.